Welcome to our seventh episode of the Lebanese Physicians Podcast. And today we have a special guest. It's Dr. Roula Farah, who is a pediatric hematologist and oncologist who currently practices at the Lebanese American University Medical Center Rizq Hospital. And Dr. Farah graduated from the Université Saint Joseph and then did her pediatric residency and fellowship actually in the United States. She did her residency at Montefiore Medical Center in New York City and did fellowship at UT Southwestern Medical Center in Dallas, and decided to move back to Lebanon immediately after her training. Moved back in 1998. And since the move, she has been very active actually in the care of pediatric oncology patients and hematology patients in Lebanon, and has established an NGO, the Chance Association, to help pediatric oncology patients and hematology patients afford their treatment in the country. And she is also the representative for the Eastern Mediterranean region in CCI, or the Childhood Cancer International. Sorula, welcome to the podcast.
Welcome to this amazing initiative. It's amazing, and I'm so proud to be part of it.
Thanks, and I'm so happy that you're here too. So, can you tell us a bit about your decision to return to Lebanon and how your practice and life has been in Lebanon since you returned?
Yeah, it wasn't an easy decision. I was doing research on leukemia, and at that time it was the trend was immunotherapy and immunotoxins. We were working on this for childhood leukemias. Then I felt that my impact in Lebanon would be bigger than my impact in the U.S. And in fact, since I came and I started working in the hospitals and treating children with cancer, I realized that American board is not enough, that having research is not enough, that having publications is not enough, because I felt that you are completely desperate in front of a child who has cancer if you don't have the funds to treat them. And this was the trigger. If you want to say, a child that I met from Damour who was had neuroblastoma, which is a very aggressive tumor. I couldn't get to any hospital in Lebanon. At that time, I called myself 9 hospitals to admit him when he had chickenpox and was dehydrated. And it was very touching to find him in the parking lot of one of the hospitals, sitting there and not being able to be admitted. So it was a trigger to start being involved with kind of more social initiative to support the kids with cancer and make sure that they have access to care. I felt that it wasn't fair for a Lebanese child that didn't have money not to get this chance of cure. We know that cancer, it's true that it is the #1 killer in children, and still there are about 400,000 children worldwide diagnosed with cancer every year. But still, in high-income countries, the cure rates are 80%. But then, in low to middle-income countries, the survival rate is 20%. So in Lebanon, we have all the knowledge and all the facilities and everything to be able to access the 80% cure. So I felt that financial difficulties and lack of access to care can hamper these cures. And this is what I totally refused and I didn't want. And we started doing social activities at LAU Rizq Hospital. It was Rizq Hospital at that time, to have some funds to be able to treat the children with cancer. And this is how I felt that my impact for the Lebanese children was bigger than just being like a regular doctor, where you can be more involved in their care, giving them a chance.
Right. Yeah, I agree, and that's why I think you developed the Chance Association, right?
Why it's called the Chance, which comes from Children Against Cancer, but it's also Chance, which is giving them a chance to be cured, and also a chance for us to help them and to be involved fully in their care. Us as doctors, but also anybody in the society can be a supporter of Chance and can help the kids to be cured somehow.
And I know that I used to when I was there. I used to consult on, even though I was not a pediatric pulmonologist, but At the time, I used to
But you know
consult.
how much we trust your judgment and how much we trust you, and the patients loved you at that time.
Yes, I used to consult a good number of your patients, and I was impressed. I mean, by the amount of support that they get from your association to be able to afford their treatments and their therapies. Because, as you know, I mean, it's very costly treatments for these patients. Uh, so, can you tell us a bit about, like, once you established the association, like, how did you get the funding for it?
So
What do you do with the funding, and how do you help the patients with that?
absolutely. So Chance wanted from the beginning to be apolitical, a-religious. So we had every Lebanese child, no matter from where they come, from the north to the south. We started as just helping the kids. We didn't really need to have an official NGO, and then Chance started growing, and it was registered as an official NGO in 2005. And last year we celebrated the 18 years of Chance. From the first child that we helped, that little boy in Damour, so far we have helped 800 children access their care. We have covered over 15,000 hospital admissions, and we have been able to make sure that at least 75 to 80% of the cure rates are reached. Now this year, with the economic crash and the COVID and all the difficulties, we are having lots of difficulties sustaining ourselves. But Chance, since the beginning, you were asking how we fund ourselves, we are funding ourselves through our activities. First, we started by having the kids draw a calendar, which became our hallmark, the children's calendar.
Okay. Yeah.
An annual calendar that the kids draw and that is sold all over to be able to have fun. We also do activities, events, brunches, dinners, awareness campaigns, etc., where we get sponsors to help us and support the association. So we relied mainly on ourselves and our own activities to get self-funded, and also on donations, supporters, families of children who have been cured and who want to help other children. So this is like a self-sustained system. Our volunteers are survivors. They are people from the society. There are people who have lived with someone who has cancer, and everybody who is touched by this I would say this chance of life that you are giving to the kids. Once is a supporter, became a supporter of Chance, and encouraged his friends to come and support our activities.
And so the next question I have for you is: have you seen a change in the cure rates, let's say, of these kids once funding was established for them, or do you know if there is?
Absolutely, yes. The Lebanese people have lots of pride,
Yeah,
and
yeah.
sometimes if they don't have the funds to come and get testing, with MRIs, PET scans, etc., for their children, they just don't show up or keep on delaying their appointments so that they can have enough funds to be able to pay for their care. You know that not everybody in Lebanon has health insurance or social security or any coverage. And the Ministry of Health does not cover any outpatient procedures, and even inpatient testing is not covered. And the budget is always small, always lacking medicines. We have lots of problems. So delay in diagnosis and delay in care hampers definitely the survival rates. And once we tell the patients that don't worry about the financial, just get the testing that is needed. Of course, the diagnosis is made earlier, the patients come at an earlier stage, there are no delays, and the cure rates will go higher. If the NGO, if Chance makes sure that everybody gets his medication on time, this also can improve the cure rates because, as you know, lack of medications, low socioeconomic status with infections. So we do a lot of teaching about hygiene, about infections, about care, psychological support. We do all this. It's a comprehensive, if you want, approach to the patient as a whole and his family. We do activities, play dates, parties for the kids, so they can see what's at the end of the tunnel. A person who just started treatment, a family, can meet another family who finished treatment, and they can tell them that there is light at the end of the tunnel. So all this, of course, the support of the Chance Association has an impact on the survival, on access to care, and on cure rates. Absolutely.
Of the patients, and traditionally chemotherapy has been covered, right, by the Ministry of Health, right?
Well, not
Correct.
really. Well, not everything, because there is always shortage of medications. You send the patient with a prescription of 15 drugs, they come back with 5 of them. So there is shortage. Not all the medications are available. And for the past 2 years, we have seen a worldwide shortage of some medications. And recently in Lebanon, we have serious shortages since the economic crash and the blast and all the problems that Lebanon is facing, which makes it a lot harder for us as an oncologist to make sure that our patients are getting their medications on time. So with chance, we had to have make additional efforts and have an extra network in order to make sure that everybody gets their medications. We are networking with Switzerland in order to get donations for medications or medications donated. We are having a very hard time finding the drugs that are missing, contacting doctors that we know through my network to help us find the medications. The parents are making lots of efforts with us, helping each other. It's becoming very, very difficult to make sure that the quality of care does not drop because of the problems that the country is facing.
Right, because you can potentially even start somebody on chemotherapy, let's say, and not be able to find the next doses that you need for the drug.
Absolutely, and that's very concerning
Yeah,
because any delays, any skipping doses, any decrease in the doses can affect the cure rates. So, in order to be cured, the most important prognostic factor is the treatment.
yep,
So
yep,
they have to get their treatment. They have to be able to access the hospitals. Chance also pays the hospital bills, which are very high,
right.
and puts a lot of load and burden on us. We pay the outpatient procedures. We pay the bills. We help cover all the financial gaps of the families, even if they have, let's say, social security. We pay the difference. The Ministry of Health will pay the difference. But now all the budget of the Ministry of Health and the hospitals for the past year or so has gone to the COVID patients or other cardiology, open heart. So the budget for really the pediatric cancer patients is getting lower.
Yep.
And because of the COVID pandemic, there is the cancer issue has become second line or like a second priority. But you know that cancer does not wait, and that one day the COVID pandemic will subside, but cancer will not will continue.
Will stay. Right,
Continue
right,
to happen.
right,
Yeah.
right. And yeah, as people know, I think we just touched on this. Lebanon has been through a severe economic crisis since at least October 2019, and it has been worsening over time, which has placed limitations on imports of medicines and other essential supplies even from outside. So from what I hear from you, there has been, I guess, significant impact of the economic crisis on the ability of your association to bring drugs and needed therapies for your patients, right?
Yes,
Yep.
yes, absolutely. You know that the Lebanon imports 80 to 90% of medical supplies and many
Yep.
medications. You know that the hospitals already after the economic crash, they have serious problems, being funded or being paid by government-related institutions. The suppliers that supply the medications want their payments made very promptly, and just a lot of issues in the hospitals with making sure that the medications and supplies and everything are being provided on time. So for us, it's the same problem. We are having more burden on the association. From our statistics between 2019 and 2020, we had 45% increase more requests for help. Some parents who were on Social Security because they were employees have lost their jobs, so they don't have any coverage at all. So instead of us just covering the difference of the Social Security, now we have to cover the entire bill. So there's lots of extra burden on the association, and at the same time, you have less opportunities to do events and to do activities. So we are
Right.
finding alternative ways. Now we have, for the past 2 years, we are online. People can donate online, and I want to thank everybody in the whole world, every Lebanese or non-Lebanese in the entire world, who are donating to the Children of Chance through our website. We started online sales. We are now on Toters. Toters is like you can order and they can deliver the things to you.
Yep.
We are on many platforms, international platforms for support for getting things from the association to help the children. And we want to make sure that every child gets his chance of cure and doesn't get affected by what's happening around them.
Right. And do you feel that there has been an impact of COVID-19 and the economic crisis on the amount of donations you're getting, or you've been able to work hard to circumvent some of that?
Absolutely. There is less. The COVID-19 and the economic crash have made our events. We cannot do events. We cannot do gatherings. So this cuts down our donations by 70-80% because this is where we used to get all our funds. So we are in serious trouble. We are applying for grants everywhere. We are making a lot of efforts to find alternative sources of funding. We don't know how long we can sustain ourselves, 6 months, 1 year, if the situation stays like that. And yet we are engaged to the maximum with the families, and we cannot abandon them in the middle of treatment. And I don't want to find myself one day looking at a family with a child with cancer and saying, no, we cannot accept you, or we cannot treat you, or you cannot be admitted.
Yeah. And so far you have not had to do that yet, right?
So far, we have not had to do that. Now we have
Okay.
refused patients who want transplant or very highly costly procedures that we cannot afford anyway. But we have not had to stop the funding for a patient in the middle of treatment or refuse a child. But I don't know how long we can sustain ourselves, and this worries me and worries the Chance board, all the time.
Yeah.
Now, last year, Chance was, because of the due diligence and all the 18 years of helping people that we had, we were able to register Chance as an international organization in Geneva. And this puts us at another, I would say, level in terms of international recognition of the impact of Chance in the Lebanese community and also the community that lives in Lebanon.
Right,
Also
right.
we have the big problem of refugees, that we have 2 million refugees who have children, who also are putting a burden on the healthcare system in Lebanon. And these are kids that are innocent, and it's not their fault. They are a victim of the political systems in the Middle East.
Right. Yeah, and we talked about, I think you're registered in Switzerland now. You still don't have 501c3 status in the US.
No,
Yeah.
one day, I
Yeah.
hope one day we can
Yeah,
do that.
yeah.
So people can also get tax deductible donations, I guess, and more. Lots of Lebanese in the US want to help, but they don't really know how. They can always go to our website and donate online and purchase our stuff and write nice things to the children and support them emotionally and mentally. The families are going through very difficult times. They are moving. Our hospitals, many pediatric oncology wards were destroyed after the explosion.
Right.
Many of the children with cancer had to be displaced to other hospitals at short notice, being put in another setup. And because of the COVID pandemic, some of the pediatric floor are being transformed into COVID floors, and the children are being placed in another wards, which puts also extra stress on the families.
Right, and as you touched on that, I think, since 2019, 2020, Lebanon has been through a multitude of crises that happened at the same time, including the economic crisis, the big port blast on August 4th, which destroyed actually some big hospitals in Beirut and partially destroyed others, and then the COVID-19 pandemic, which is raging right now in Lebanon with hospital beds full of COVID patients, which is taking away from the care of other patients because one, the beds are taken, and number two, the resources are being used on a lot of the COVID patients at this point.
Absolutely, and many doctors also are leaving the country because they want to have a stable life with their families, which we understand. This also the manpower. We are losing great doctors. You're an example of one of those that Lebanon lost, but you are doing a lot from far away. And being a doctor now for me in 2021 is not just about administering medications or giving a prescription for medications. It's the total social engagement with the patient, head and soul, if you want. Because you have to be the social worker and the psychologist and the supporter and the fundraiser and everything for the patients in order to sustain the care.
Right.
You can't just be limited to just giving medications, which puts a lot of responsibilities on the doctors, which shouldn't be the doctors' responsibilities if we are in a country or in a system that is functioning.
Right.
But
Right.
we have no choice, and it's so much, brings such a joy and pride to see all the cancer survivors. And we're established the first cancer survivor program with Chance, and we have hopefully we spoke to you about that before you left, the first cancer survivor clinic at LAU. We were still working on that, but everything is on hold. We feel like our lives, our careers, and everything is kind of in a turmoil and on hold at the same time.
Right, I know that. I mean, I witnessed part of that because since the revolution on October 2019, things have been relatively unstable. We can say that it has put a lot of the plans of a lot of things on hold because of that. Yeah, and you said, I mean, smart doctors are leaving, but also a lot of smart doctors are staying. Like you're still battling on, and that's impressive. So, so can you give us, so what's the chance? I'm gonna put it on my podcast too, but just to say it here too, what's the website for Chance and the best website to donate to?
www.chanceassociation.org.
Yep.
And they can email us also at chanceassociation@gmail.com.
Yep.
So the website is www.chanceassociation.org. We also have Instagram and Facebook, and please, they can follow our news and they can write us their messages and they can give us ideas and they can put their qualifications, at the service of the children. There's nothing nicer than the joy of giving. And I think this is what keeps us and sustains us in Lebanon, is seeing the gratitude of the families and the gratitude of the children, the eyes of the children. You've seen them on the floor, full of life, full of desire to survive. And you look at them and you say, I can't abandon them. I mean, no way, you have to keep going.
Right, exactly. And once just because I think people might ask this question, so when you donate to your website, does the money go to a Lebanese bank or does it go to a more secure location?
It goes to a Lebanese bank, and when it is coming from outside of Lebanon, they do take a percent, but they do give the money, and it helps a lot for covering the hospital bills. There is also, they can always donate to Chance International in Geneva also, and it goes there to be able to purchase. We just purchased medications yesterday, and now we were able to bring 5 boxes of medications that were not available in Lebanon. And this is why I'm so happy today, because after 2 weeks of suffering and trying to get these medications for the children, we got them right on time. Like I had a boy with a platelet count of 9,000 that's not responsive to anything. I was able to get him one El-Jumbo bag from overseas.
Excellent. And so, do you have a preference? Like, if people want to donate, do you have a preference whether they should donate to your Chance International or to which helps you better, like donations internationally or donations in Lebanon?
It's great, but the most important is not to forget that these children are in a race against their disease. They are in a race for their lives, and it is our duty to continue to support their I would say their battle for living and for beating cancer.
Great. Yeah, thank you, Rula, for doing this podcast with me. And just in summary, I think we've discussed you're moving back to Lebanon, and then you're establishing this great association over there, which is helping a lot of kids. And hopefully, I will list all the websites on the podcast, and hopefully people will donate to your organization and help the kids in need at these hard times in Lebanon.
And I want to say that February 4 is World Cancer Day, and February 15 is International Childhood Cancer Day, and we are having a very nice event from the broken glass of Beirut. We are making with a local artist art pieces with the children, and we're going to display it on International Childhood Cancer Day. So stay tuned to watch what creativity we have from the rubbles and from the destruction, what kinds of creativity we have to promote life and to promote hope and to promote Lebanon overall, the Lebanon that we love and that we want to rise again.
Yep, hopefully it will rise again soon, hopefully.
Thanks for all your efforts, Khalil. We are proud of doctors like you and proud to get to know you and to have had the opportunity to work with you. And I want to thank you for all what you're doing from afar. I know that part of your heart is in Lebanon, and all of us
Yes,
that have left Lebanon, we always felt that part of us remains here. It is our roots and it is our soil and it is our ancestors and our children that we are, pushing forward. We can
right.
never forget our country.
Exactly. Thank you, Rula.
Bye.
Thanks.
Thanks
Bye.
a lot.
Bye.
Bye.